Learners, welcome to my channel. Today we will discuss about artificial ventilation. It is also called as a mechanical ventilation. It is done by the ventilators artificially. It need for the ventilation is nothing but that is a breathing process. It's needed for the mission. They are ventilators. It will be needed. They fixed with the artificial. So the ventilator delivers gas to the lungs with either negative or positive pressure. The main concept, that is, the ventilator delivers, they are the pressures will be given to the lungs, that is the exchanges of gases, maybe the negative or positive pressure. So these having the two types, the ventilation, they having the two types. One is a invasive mechanical ventilation, non-invasive mechanical ventilation. What is the invasive ventilation? It's nothing but they involves the placements of an endotracheal tube through the mouth or nose into the trachea. The tube is connected into the machine which produces a certain amount of air to the lungs. So in case the normal person, they are exchanges of gases through the nose, trachea as well as pharynx, larynx. Already you know that is the process. Okay, the lungs, it will be intake of the oxygen, and the exhale process, that is a carbon dioxide, it will be relaxed, they are removed. Okay, but the mission, it will be ventilator missions to the mission, it will be connected to the from enter into the mouth or nose into the trachea. This trachea, they followed by the amount of air, it will be exchanged and passes to the lungs. So it said the number of breaths per minute. These are adjusted according to patient's levels of oxygen and carbon dioxide. The patient should be monitored an intensive care unit. This diagram shows that how to the oxygen will be intake through the mouth, that is our nose, trachea into the lungs. Then next one, non-invasive ventilation. The non-invasive ventilation is nothing but it is the opposite to the invasive. That is, it's a non-invasive means it is the exchanges of or exhale process. In this process, that is the carbon dioxide is removed by an external device. It's most commonly used for patients with mild to moderate or difficult to breathing. It should be monitored to avoid the breathing difficulty does not get worsen. These are the non-invasive ventilation process, that is the carbon dioxide, they are exhale process. What is the purpose of artificial ventilation? What is the needed? Why they are needed for the ventilation? They already you know that the human being need for the respiratory system. Everything they needed, they must. Once the inhale exhale process is not occurred, the human does not properly once the proper air process it will be occurs means they finally they maybe it will be happened to maintain or improve the oxygen level in our body, to decrease the work of breathing and improve patient's comfort. What is the types of artificial ventilator? The negative pressure ventilator as well as the positive pressure ventilator. The negative pressure ventilator, that is the ion lungs. The patient's body will encase an ion cylinder generated, it's restricted. So this diagram show that that is a ion ventilator, that baby they needed for the negative pressure ventilator. The positive pressure ventilator, it produces the positive pressures to the patients during the inspiratory phase. Symptoms of oxygen toxicity: flushed face, dry cough, dyspnea, chest pain, tightness of chest, and sore of throat. So these are the basic modes of ventilation: assistant control ventilation, volume control, and assist control ventilation, pressure control, like a VC as well as a PC, pressure support ventilation, synchronized intermittent mandatory ventilation volume control, like the simple term SIMVV, synchronized intermittent mandatory ventilation pressure control, SIMVP. So these are the ventilation, artificial ventilation. So thank you. I hope this part it will be clear. Thank you all.